we have the sheep heart. The heart was compressed in a bit of a wrong manner, I guess you would say. So here's the visceral pericardium, the epicardium of the heart, the outside, essentially the skin of the heart. Here's the apex of the heart, and then this up here is the base. This is the aorta, the ascending aorta. This is the left auricle and the right auricle. This is the left atrium, the left ventricle, the right ventricle, and the intraventricular sulcus. The auricles are used to transfer blood between the left and right ventricles. And then you have the, on the posterior side of the heart, you have the left and right atriums. And you have, so again, the heart should have been compressed like this. So this would be the left ventricles, the right ventricles, the intraventricular sulcus. The left and right atriums are going to be back here, respectively, on their sides. And then the auricles right here and right there. So the blood from the right atrium is deoxygenated. The blood from the left atrium is oxygenated. The auricles are used to transfer blood to the left and right ventricles, and the intraventricular sulcus houses the coronary artery and the great cardiac vein. The pulmonary trunk is the anterior vessels, and the blood is going to the right ventricle from, so this is the pulmonary trunk. The blood is going to the right ventricle from this pulmonary trunk, and it is oxygenated. The aorta is going to the throughout the whole body, leaving the aorta, going out through the whole body, and is oxygenated for all the vital organs. And then you have the ascending aorta. So the aorta goes down into the ascending aorta, and the aortic branch has the brachiocephalic artery, the left common carotid, and the left subclavian. This here is the superior vena cava, and the superior vena cava goes through the heart down and would exit through the posterior side of the heart. The coronary sinuses are going to the right atrium. These are veins that are that carry deoxygenated blood. Okay, this is the myocardium of the left ventricle. This is the inner wall of the left atrium. We have the left bicuspid valve that comes down right there where the probe is pointing at. And the probe comes through the aorta and the brachiocephalic artery to the left ventricle. We have the mitral, or the left AV valves, or atrial ventricular valves, that connect the atrium and the ventricle. And then going on to the right side of the heart, we have the right AV valves, or avioventricular valves. We have the papillary muscle that's inside of the ventricles, and then the pulmonary semilunar valve, and the aortic semilunar valve right up in there. Okay. This is the right side of the heart. Here you can see the right tricuspid valve, the right AV valve, that is the atrioventricular valve, the papillary muscle, the ventricular wall, and then the aortic semilunar valve right there.